As heads of state and government gather for the 79th United Nations General Assembly at the Summit for the Future. The event led by President Cyril Ramaphosa and the chair of the Global Leaders Network for Women's, Children's and Adolescents Health will issue a call for action to address key challenges and rising opportunities to accelerate action in the final 5 years to the 2030 SDGs. Let's take you live to New York.
And in thanking heads of states and heads of government for being here, we thank you for being here because the issue of health needs of women and children and adolescents requires urgent and sustained political leadership and attention by all of us. Now, at this 79th session of the United Nations, we have a great opportunity to accelerate the actions that need to be taken to continue achieving the Sustainable Development Goals that are particularly related to women's, children's and adolescents' health. Because it is, as we saw on the video here, an area that needs a great deal of attention as we approach the 2030 deadline. Investment in development is declining. Inequality, as we can see it around the world and in various countries, is increasing, and the progress that needs to be there is stalling. This is manifest in the distressing population health and economic outcomes that are there for all of us to see in various countries. On average, across the world, and we saw some of the figures here, it is quite harrowing to hear that as this video just finished, 15 women will have died. And it is really concerning that so many women continue to die, and across the world a woman will spend 25% more time than men in poor health. This reduces productivity and earning potential, but it impacts negatively just on the basic human life, particularly of women, children and adolescents. In Sub-Saharan Africa, the likelihood of dying from childbirth is 50 times much higher than it is in a place like Europe. Each year there are 35 million unsafe terminations of pregnancy. That is an astounding number. This is resulting in life-changing injuries for millions and the deaths of these many women who are subjected to this. In 2022, it is said that 4.9 million under 5 deaths were recorded, most of these from preventable causes. Low and middle income countries are in the end the most affected by this. They continue to face, the people who live there continue to face challenges of the fragility of their health system and in equitable access to health and health-related products. In 2022, an estimated 13% of adolescent girls and young women across the world gave birth before the age of 18. And in my own country, it has also been reported that girls as young as 11 are giving birth to children, thus dropping out of school, but more importantly, you can just imagine to their health themselves being so negatively affected. And yet, we see a downward trend in donor aid for reproductive health and maternal and newborn child health as well. Countries are struggling with domestic funding allocations to cover all these essential needs. The Global Leadership Network provides a platform for leaders like ourselves to work together to address these persistent issues. And by leaders like ourselves, I'm not talking about the heads of state and government. And many of us who are here are leaders in one shape, form or other, leading various organizations, various institutions, and various areas of activity. So once again, I thank Her Excellency, the Prime Minister of Denmark, Mette Frederiksen, and His Excellency President Ruto, and His Excellency Abiy Ahmed of Ethiopia, and His Excellency President Joseph Boakai of Liberia for joining this call to action. I thank His Excellency Julius Maada as well, Bio, of Sierra Leone, His Excellency Majaliwa of the United Republic of Tanzania, and also His Excellency President Faye, who would have been here but is of Senegal, for also joining in leading this initiative. We also appreciate the support of the WHO, as well as UNICEF and UNFPA, as we move the global network leaders forward. Together, women and children and adolescents comprise more than 65% of the global population. Addressing their challenges, their needs, can in the end fundamentally shift the global health landscape. And this network will advocate for sustained and enhanced financial investment, contributing to the growth of nations and enabling individuals to reach their health potential. According to a report by a leading health economist institution, by addressing the health gap between men and women, we could boost the global economy by at least $1 trillion annually by 2040. By addressing the health gap, 137 million women could access full-time employment by 2040, lifting millions of women out of abject poverty. We must engage entities and organizations like the G7, the G20, BRICS, and many other blocs to carve out a focused agenda that ensures the necessary investments will be moved and flow into women, children, and adolescent health. This is an absolutely necessary area of investment. The Lusaka agenda, which enhances coordination and accountability in health financing architecture, can be used to track investments. President Boakai, we knew that you were coming, and I'd like to welcome you as you arrive. So don't worry too much, you're sitting next to me, so you're okay. Now, in September last year, governments and philanthropic organizations committed to increasing investments to end the shortfall of funding for life-saving family planning supplies. These commitments, the life planning area is another important aspect that we need to look at very closely. We need to give greater attention to ending gender-based violence as well. We have also seen that the high rates of unintended pregnancies contribute to maternal mortality, especially among young girls. The UN and the African Union, through the Maputo Protocol, recognizes the right to bodily autonomy, especially for girls and for women. Yet we continue to grapple with this question of termination of pregnancy at the political level. And as we watch television, we see the debate raging in a number of countries, and particularly some big and leading countries where a lot of electioneering is taking place. And did I say that in the wrong place? I shouldn't say things like that in a place where these things are happening. And this is even the case, though the WHO has presented evidence that where abortion is legal and where safe services are accessible, both unsafe and related mortality and morbidity is reduced. The Global Leaders Network advocates for life-saving interventions as well as sexual and reproductive health rights. Now, as South Africa, we know this from experience. The Choice of Termination of Pregnancy Act, which adopted soon after our own freedom, contributed in 1996, contributed to a decline of termination of pregnancy-related mortality by 90% between 1994 and 2021. This law that was passed through a democratic process amidst robust debates and significant pushback, but it is now being implemented, and it has resulted in a great deal of progress and success. But in the end, scores of women's lives have been saved. Prevention of unintended pregnancies, sexual education, and preventing violence against women and girls are still priority interventions. But complementing these with sexual and reproductive health rights can save more lives. We understand that countries have the sovereign right to make determinations on issues of termination of pregnancy, and that should be respected, because in the main it could be an expression of the will of the people. The Global Leaders Network is called upon to protect the rights of vulnerable populations and present evidence that demonstrates a reduction in morbidity as well as in mortality. We therefore issue a call to action. We call on heads of states and government to seriously take women and children and adolescent health up in everything they do and join the Global Leaders Network. We also call on countries as well as on donors and commercial and developmental investors to carve out a specific and we do, yes, also make a call on countries across the world and to work together and cooperate to meet the financing targets for organizations that support women, children, and adolescents' health. These include the Global Financing Facility, UNICEF, and UNFPA. We call on stakeholders in the women, children, and adolescent health sector to target those countries with the highest maternal, neonatal, and adolescent mortality rates. And there are quite a number of these. And we also call on academics and civil society to continue to provide evidence and compelling arguments so that urgent political attention and including investment in the health that affects women, children, and adolescents. And we call for equity in manufacturing, in access to sexual and reproductive health products, and in quality health services for women, children, and adolescents. And that should lead to the health systems being strengthened, And that also should address the health outcomes. Now, as the chair of the Global Leaders Network, I want to thank everyone who's been involved in this critical initiative. And by your mere presence here and the work that many of you continue to do in your various positions and organizations, you are helping to move the needle. But we need to do much more to save the lives of millions around the world. And we can, I believe, reduce poverty. And I do believe firmly that we can improve productivity and develop economies and transform communities across the globe. By improving the health outcomes for women and adolescents, we will be taking steps in that direction. So if we all act together, but not only act together, but we need to raise the level of awareness and consciousness, because quite often you find that many people are not so aware and well conscientized about the alarming statistics that we saw in the video, that women continue to die needlessly, and yet we can take action to prevent that and to lessen the deaths of women, but to also improve their health. Women, children, and adolescents must be prominent in our agendas to improve health across the world. And so if we can continue with that resolve, we will certainly achieve a number of objectives. Thank you very much for being here.
And there you have it, President Cyril Ramaphosa there speaking and rounding up that discussion as chair of the Global Leaders Network, urging that the topic of women, children and adolescents must be prominent in agendas to improve health across the world, and making a call for a call of action, acting together and raising awareness when it comes to women, children and adolescents.